And now we start scanning with the scan healing caps on top. And you're gonna see how easy the scanner will find the new position of the op stage.
Hello everyone, thank you for joining us today. My name is Jenny and I'm a part of the education team at Medit. Nice to meet you everyone. Today we have Dr. Bogdan here.
Hello guys.
Nice to meet you.
Nice to be here.
Dr. Bogdan always gave us a best lecture regarding implantology, but today's one is the advanced topic that's about full arch implant scanning. So, Doctor, can you tell us some contents that you're going to discuss with us today?
Yes, of course. After going through the simple cases, the small cases of scanning implants, today we are going to go to full arches using commercially available systems, and we are going to cover the OptiSplint system and also the Scanalogs from DAS, the guys from Spain. And with these two systems, I'm going to try and give you possibilities to do full arches. One is done for the guys that are capable of scanning an arch, even if they are having a little moving tissues. The other one, if things fail and you don't get a good scan, you just take an impression and use the second system, and you are going to scan the interior of that impression with Scanalogs mounted on that part. And with these two systems, I hope that you guys are going to be able to cover most of the situations. Of course, we are also going to give more solutions in the future webinars that are maybe even more easy to use, but I feel that these two systems have taken off really well and they are available everywhere, and it would be a great opportunity for you guys to know how to use them.
This topic seems very interesting. So everybody will love your lecture today.
Thank you so much. Let's get started.
Okay. All right. Thank you. So as always, right after the lecture is done, we are going to have Q&A sessions. So we've already collected all the questions through the email in advance. So we will cover those questions today. And while watching the webinars, if you have any questions, then simply go to the chat box under the video, then write down. Then we reply back with your registered email. And if you have any further questions, then feel free to contact us meditedu@medit.com. And for more clinical videos, or if you would like watch the previous webinars, you can visit our YouTube channel. And we also have an official training platform, which is Medit Academy here. So videos are listed up according to the curriculums, and you can obtain the summarized text files. So you can utilize our Medit platform to enhance your knowledge regarding distal dentistry. Okay, shall we begin, Doctor?
Sure. Hello, my name is Bogdan, and today I'll be presenting full arch implant scanning done with commercially available systems from OptiSplint and DAS. And without further ado, let's see what we have in store for you today. So the OptiSplint system from Digital Arches is given to us by our good friends from Graham Dental. And Scanalog system from DAS is brought in by AGC Udent, the IMSI cord importer of Romania. Thank you both for having those available for our presentation. Let's start with an unboxing of OptiSplint. As you'll see here in this neat little box, we're going to find 6 scan bodies. And in each bag of the scan body, you also can find the screw. It's a particular screw. And we're also going to have scan healing abutments and digital analogs that we're going to present at a later stage. These ones that are placed on the interior of the 10 prostheses, and 2 frames, and they are cording carriers. So, the scan body has 3 parts. It has a scannable part that is displayed in the green box. This scannable part is very easy to capture and is sandblasted. We are also having a connecting part in blue. That connecting part comes and fits over the multi-unit, directly to multi-unit. And wings, one vertical and one horizontal, are used to put everything together and to fasten the scan bodies with the frame you saw earlier. And we're going to see how we do this as well. Scan healing caps are either the ones found in the box that are plastic and only one use, or you can also buy scan healing caps made out of metal that are much more durable and you can use them many more times. They have a little disadvantage because they are sandblasted and if you leave them there for more time, they are going to gather a little bit of debris. So let's see further what's in the box. We have the frames that are used in combination with the wings of the scan body to weld everything together. The scan cap analogs that are placed inside the fittings of the prosthesis for the multi-units and are going to help us align this set prosthesis, 10 prosthesis to everything else that we scan. And the arch tracers, these arch tracers are not actually found inside the box and can be bought separately, but they're very little neat trick that the guys from Optisprint have. They are going to be screwed in on the labial surface of the jaw before surgery. Then we are going to scan everything together, the jaw without any surgery done yet, and these arch tracers. Then we are going to open the flaps, do everything that we need, bone reductions, placing of the implants, grafts, and after we suture, probably the scanner won't be able to pick up the position that this new jaw has in relationship to the old one. So we are just going to scan this new modified post-surgery jaw with the arch tracers in place, and we are going to align everything together using the arch tracers pre-op and op, and although nothing resembles, it's going to be a very easy step because the arch tracers are big enough, provide the geometry needed, and are very easy to impression. Okay, to get all the needed information, we are going to need an antagonist scan, a pre-op scan, an op scan, occlusal scan, and also a lot of additional data scanning. For the additional scan, what you see here is scanning of the denture. We start from the occlusal surface, then we go to the palatal surface, and then to the labial surface of the denture, and we scan everything together. We make sure that the scan is precise. And then we are done here in this step. If we would like to also get the interior of this set denture, we should first reline it with material and then start the scan from the inner side of the denture and go to the teeth. Okay, in the next step, we are going to scan the pre-op. The pre-op is being composed of the temp prosthesis of this patient, and we start from the occlusal surface, and we gather a lot of detail. It's very easily scannable. It's like a fixed prosthesis. It's a fixed prosthesis, so it has a lot of detail. But we will also try going from the occlusal down to also get the fixed gingiva on the labial and also on the lingual side, because this fixed gingiva just beneath the prosthesis is going to help us align the scans all together. And as you can see, even if we angle the teeth, we just try to get the lower side of this prosthesis that comes together with a fixed gingiva. And also, after everything is done, we are going to go posterior of this prosthesis and get the fixed gingiva of the rest of the jaw on the distal. Okay, now we're going to scan the occlusion starting from the canines and going to the molars. I'm trying to really get as much detail here as possible on both sides to be able to get a good fitting of the final prosthesis. And now we are going to remove the temp prosthesis and place scan healing caps on the field. And after we place them, the implants in the front are a little too tight together, so we are just going to skip a scan healing cap. We placed everything in, and now we are going to start and delete the temp prosthesis. And here I want you to be extra careful and not delete the fixed gingiva just beneath this prosthesis. So get extra careful, get slow, and just cut a little bit of the prosthesis and the gingiva, leaving as much detail here as possible. We go around with a trimming tool, and as you'll see here, once everything is done, we have a floating prosthesis, and we're just going to treat it as a floating island, and it just disappears. And now we start scanning with the scan healing caps on top, and you're going to see how easy the scanner will find the new position of the op stage. We're going to just add data. Scan healing caps are going to help us a lot with this, because they add geometry to a flat ridge. This is one of the possibilities. And as you can see, we try to get first the upper part of the scan healing caps, but then we angle the tip of the scanner in such a manner that we try to capture all of the geometry of these healing caps. So, or at least as much of it as possible. Because a neat trick in the end, if you have a healing cap, you can really subtract it from this scan, and also so you will get the healing profile. Okay, go to the next stage, and we are going to scan the prosthesis with the scan analogs on its interior. To do this, first we are going to remove all the gingiva, and we are going to use smart data cleaning. We just go and deselect the strength. We go in the lock option, and in the lock option we are just going to lock the teeth. Now we are going, because the teeth are locked and cannot be deleted, we get outside the locking stage and just select everything. And now, because we select everything, but the teeth are blocked, only the gingiva will be selectable, and in this way, we have just removed all the gingiva. Okay. So now we deselect everything, we close this, and we are going to start taking, impressioning new data over the prosthesis with the analogs already inserted in the multi-unit fittings on the said temp prosthesis. You can see data is adding up nicely. We try to get everything because one, this is going to be usable as a nice wax up if everything is to your liking, and second, these scan analogs can really help us align this prosthesis with the scan values if we are not able to do a correct alignment based on the gingiva. So, as you can see, the last pieces of data are revealed, and now we are done. Okay, now we are going to seat our scan abutments. We are going to place each scan abutment so that it can actually, that the wings face the lingual side, and we try to get every wing facing the midline so that our frame that we are going to place over them sticks to everything together. So now the last scan body is fixed. We tighten everything very good together. Okay, now we are going to start injecting material in the wings. First we test the frame. In this case, I think we use the big frame because we have 6 units. So we start injecting material inside the wings so that this material gives retention to the surfaces. And now we place the frame and add material on top of it, bringing everything together. And now we hold everything in place until it sets, and we are ready to scan. Now, I would like to mention that one of the uses of OptiSplint is to actually in this step screw everything out and scan this outside the mouth, be it with your intraoral scanner or send it to the technician to scan with a lab scanner. Scanning with the lab scanner of this structure will give a huge precision bonus. But you will have to be very attentive because these materials, when setting, are going to contract. So if you want to send this to the technician, you have to validate your material that you are using to have as little contraction as possible. This is why I actually don't like to remove them from the mouse and scan them inside the mouse to not have to be confronted with contraction and maybe a subpar impression on the lab scanner. But there are materials that the providers say that have almost zero contraction. So if you want to do that protocol, just please validate your material and setting. Okay. Now we are going forward to scanning this structure. And to scan this structure, as you can see, we start from one scan body and try to get to the next scan body by using the material on top of the frame and on the wings. This is because it has a lot of geometry, as you can see. It's very easy to scan and to go forward to. So we jump from one scan body to the frame, then to the next scan body, then again to the frame, and then after everything is tied together in one mesh, we start adding data from beneath the scan bodies. We already got parts of the jaw, but now we can actually try and get more and more of the fixed gingiva and try to angulate our scan tip between the scan bodies and get as much data as possible here. Now, what we have here can be aligned, as you'll see in the end of the presentation, in two ways, by using the fixed gingiva, and this is why we try and get as much fixed gingiva in this stage as possible, but it can also be aligned to the temp prosthesis by using the analogs that we just scanned in the previous step. Okay, so this is going to conclude our presentation of OptiSplint, and now we are going to jump to the next system, the DAS analog, that actually is meant to help us with very difficult situations where we can't get enough scannable surfaces on the mandible, sometimes in the maxilla, but mostly on the mandible. So what we are going to do is going to to mount transfers inside the mouth and pick them up with an open or closed tray, and then mount these scan bodies, negative scan bodies, inside the transfers and scan the actual impression and not the surfaces inside the mouth together with these negative scan bodies, and this is going to give us enough data to build the final prosthesis. This is a very easy technique. So let's start by fixing in transfers on the multi-units. You can see this process is straightforward, as we all know it from the classic impressions. And after we do this, we are going to use custom tray in this situation. I did a custom tray. You can do whatever you like. You can start adding impression material, flowable impression material, as we've seen in this step. We add the material, Then I'm placing my custom tray that I've printed before and add some more material. Okay. Now, when everything sets, you just unscrew the transfers. And what I want to say is that although I use only impression material to stabilize everything together, I'm a very big fan of actually making these structures, binding the structures together with floss. And after I bind everything together, I like using these acrylic materials that I use to fasten everything together. And after everything sets, I'm going to use a burr, a very small burr, to cut between the transfers, and then I'm going to put some more acrylic on the cuts so that I have as much of a passive transfer as possible. After I do this, we are just going to place the scanalogs on the transfers like they will be implant analogs and start scanning the negative of this tray. Let's see how this goes. It's very fast and very easy because nothing is moving. We try to get the tray as well as possible, and also we are trying to get every information out of these negative scan bodies. Nothing is left out, and then we go forward, and we are going to get a very fast impression, very easy. This is very, very nice for practitioners that are not so familiar with intraoral scanning, and that these guys are finding it very hard to scan moving tissues. So if this is a problem for you, DAS is a very good solution. As you can see, scanning is almost done in not more than 1 minute. Everything is now placed together. So now that everything is in place, we have two possibilities of handling this data. One would be to send it to the technician and leave him to setting everything together, to placing the meshes in the correct position. But we can also do this ourselves, and frankly, I'm a huge fan of doing this because I can validate that what I scanned is correctly correlated. So to do this, we are going to open Medit Design, select the meshes that we need, everything together. I forgot one, so I'm going to add also add this together. And as you can see, we can now start aligning the objects. First, we are going to align the prosthesis with the digital scan analogs. And this is going to be very straightforward, and we're going to handle it, as you can see, automatically, for the simple reason that there is a huge amount of common data between the pre-op and this prosthesis. So the pre-op is going to be the fixed position, and this prosthesis that is an additional scan is going to be brought on the correct position. As you can see, everything is green. And going further down the road, we are going to deselect these meshes and now align the op stage that contains the scan healing caps that we did before with the scanner buttons. And to be able to do this, of course, we are going to try an automatic alignment, but this is very rarely possible because the information is so widely different. So to do this, we are going to use a 3-point alignment. We are going to look for data that is present in both scans. And after we validate everything, as you can see here, we have 2 distal points and 1 in the middle. Everything is brought together. We check that everything is aligned, and as you can see, the gingiva has a green line all over the place. And now the scan bodies are in a correct position to the pre-op. So if the mesh alignment between the scan bodies and the gingiva was not successful, You can still do it another way. You're going to go to ExoCAD and import the scan body mesh there. You're going to use the library provided by OptiSprint that is going to generate perfect surfaces of scan bodies that you are going to align to the scan. And once this is done, under the scan bodies, you will find digital analogs floating, and you can align first the temp prosthesis that also was scanned with digital implants, digital analogs to the scan body stage. And after you align the temp prosthesis, you can align the pre-op, and the pre-op comes together with the antagonist, and then everything is aligned together using this second way around. So let us see if this is everything is done. And we have this time aligned it by using the gingiva. We are going to go a step further and now align the DAS scan bodies. Everything, as you can see, every mesh is now in the correct position. Everything placed nicely together. And now we have the scan analogs, the negative scan bodies, to be placed in the correct position to the pre-op stage. Let's see how we do this. First, we are going to clean our mesh. And we are going to cut out everything that we don't need. Then we are going to duplicate this mesh and create a scan body mesh. And to do this, now we are going to have two meshes. One of the scan bodies. As you can see, we can select all scan bodies. And after we do this, we invert the selection, delete everything, and now we have the scan bodies floating in regards to the first mesh that contained the scan bodies and the impression, the analog impression. Now we select in the first impression everything together, and now we delete the scan bodies. And now we'll have two meshes, as you can see. We clean the parts that we don't like, and now we flip this mesh, making it a positive out of the negative. And now we'll have the positive image of the arch, of the imprint, the impression, and on the other side we have the scan analogs. Now we can cut out what we don't need furthermore, just using the fixed tissue. And now we have a clean mesh with the analogs in place, and we are going to align the scan bodies and this flipped mesh to the actual gingiva. We are going to use a group alignment so that everything comes in together. Although we are going to align the impression to the gingiva, this alignment is going to also bring in the scan analogs. Let's see. We place 3 points. Now 3 points on this gingiva scan as well. Everything comes in nicely together. And now we check everything, and we are going to see a green line all together from one side to the other. Now let me check. Now the last part, we can just cut out the scan healing caps. We don't need them anymore. We can just leave it clean. Here in this step, I'm going to pause a little to explain. If you scan what I said before, if you scan a scan healing cap and do a solid model of the gingiva with scan healing caps, now you can actually subtract an aligned scan healing cap from this said model, leaving you the emergency profile of the gingiva if you need that as well. Now let's see everything lined up. Scan bodies, OptiSprints, negative scan bodies, everything is there. Now that we have all this data, we're going to talk a little bit of the prosthetic solution that I'm using after taking such impressions with set systems. So I don't know if you had this problem. I certainly did, that my prosthetic parts kept breaking, and they kept breaking where the thigh bases were located. So they were never thick enough. I had always breakage, so to avoid this breakage, I would actually want to find a way to eliminate these tie bases. If I would do so, and I would use a conventional screw to tighten directly to the multi-unit, as you can see in the left picture, because the straight screw would actually hold together just a slim piece of material to the multi-unit, everything else but metal would break there. And this wouldn't be acceptable. So the only way I found to get rid of these possibilities was by using the Rosen screw. This is an amazing screw that actually doesn't torque together on a small lip of material that would always break, but it torques down on a cone. And this system on the right actually doesn't need tie bases anymore, and also it only requires hand torquing, so no more than 10 to 15 newtons it's needed. You can also use an angulated channel up to 10 degrees, and this is my preference and my choice when doing direct zirconia or graphene or any other restoration. I stopped using metal bars a long time ago. And actually, when the patients come back, I never have complications, I never have breakage, and the screws, when taking these prosthetic pieces down to clean them, are still very well tightened, and I'm very, very happy with this solution. So thank you everybody for watching this presentation. Hope to see you guys soon.
Okay, thank you for sharing all your tips with us, doctor. Let's move on to the Q&A session. Okay, question number 1. Is there any case where you still do conventional impression?
Well, as you can see in the pictures above, from single implant cases to lateral distal cases to full arch cases, we never do traditional impressions anymore. We use techniques, some described in today's webinar, and also we have some tricks that we are going to share finally in the next ones. But as you can see here, everything is done with fully digital workflows, and the results are during these last years are passive and without complications. So I am confident that what we are sharing is going to help you out and have great cases.
Question number 2. How do you set a new VD for those who have lost their VD?
So for these kinds of patients, we either do wax rims or wax rims equivalents in the digital workflows. As you can see here, this is done in Medit design. We printed this, we added some wax on top, and we registered. Then after determining the bite, we just registered bilaterally. But in the last few months, we have actually jumped to a new technique. This technique is provided by the Mod Institute, and Wally was so kind to share this with the community. And as you can see on the left, using a gauge, the actual dimension of the relationship is determined, and then we are using a Fox plane that we print, and on this Fox plane we mount a plane that also contains the intercanine region as little veneers, so that we can determine how much of the teeth we see from the under the upper lip. This is then going to be placed inside the mouth with impression materials, first for the maxillary, then for the mandible. And the planes are going to help us out tremendously because we can set the plane correctly, seeing outside the mouth what is happening inside. And also this is going to allow us to get the interrelationship of the two jaws. Then we are also doing the mandible. As you can see, this works for the dentate with edentate. So one arch is denture, and the other arches with teeth, or also works for both arches when teeth are missing. And in the end, with these impressions taken, we can match the intraoral scans to this interrelationship that you can see here that we also scan. And we have the ability to also do smile design with this technique. So I do encourage you to look it up. It's a very nice and predictable technique.
What's the name of this system again?
This is provided by the Mod Institute as a free resource. You can find it online on their webpage. You just Google up Mod Institute, and there everything is explained. You have tutorials and also the files needed to print this system. So it's very fast and very easy to do. I really like it. In the past 2 months, I used it and I am content with it, and also I'm hopefully going to present it in a future webinar.
Then do you need to have the printer to print this system?
You should have a printer in your clinic, but if you don't, any digital lab in your area can print files for you. So yes, you are going to need to print some files for this, but it's really easy to do. And the Fox plane is reusable. So because that tray that you see inside the mouth, you just use once for every patient. So you have to print it every time and then you throw it away. But the plane is reusable. So you print it once and use it for all the patients because it doesn't get inside the mouth.
Is it reliable and predictable, you think?
Yes, in my hands and Wally's hands, it seems to give very good results. He's much more proficient with it and already does full dentures in one session. So 1 or maximally 2 sessions, jumping from the 6 needed in normal dentistry, in analog dentistry, to go to the digital workflows and only have maximum 2 sessions is incredible.
This system seems very interesting and will be very helpful for those who have some concerns about setting the new VD. Okay, question number 3. How do you scan when scan bodies are too close to each other?
So when we have 2 scan bodies, like you see on the left, this happened, and there is no solution in analog dentistry. In the digital workflow, you scan one scan body, then you block it, and then you scan the second scan body. For this to be possible, first you'll have to have the scan bodies with the scannable part, with the library part, facing a different direction that the first one does. And also you have to have some landmarks. As you can see on the left, there are a lot of teeth. So when you remove the first scan body and place it in the same scan body is placed in the second implant, you still rely on the landmarks like the set teeth here to be able to get a good position of it. But when you have a full arch like you have on the right, this is a problem because you have no landmarks there. And you have to actually modify the scan body a little bit. In that case, I used a burr and just cut out a small part of the scan body where it was touching the other one, so it was able to fit passively, to fit the arch passively. You can also try and do 2 scans, one with, as you see there are 6 implants. So we can do the first scan with 5 implants and not mount the 6th scan body, and then do a second scan with the other scan body placed on the second implant, and then overlap the scans. This is also a possibility.
It means you take scan twice.
Yes, we scan these areas twice, and then in Medit design we superimpose the 2 scans.
I see. Okay, thank you for explaining very easily.
My pleasure. My pleasure. Hope it helps.
Yeah. So, okay, that's all about our keys that are prepared. Okay, thank you for being here, Dr. Bogdan.
My pleasure, Jenny. It was such a nice opportunity to arches, and we're going to share more and more information during the next webinars. and hope everybody is happy with it. And it was a pleasure seeing you guys. Hope to have you on board for the next one.
It was such a pleasure to have you here. Thank you for being here, doctor.
Bye.
Bye.